Doctors and big pharma. So I get this question like all the time. Hey doc, are you guys being paid by big pharma? You know, you guys are all paid by big pharma. That's why you prescribe so much medications, blah, blah, blah. No, we do not get paid by big pharma. Not at all. Not one bit. Please just stop. I prescribe medications to people who need them. In fact, I go out of my way to not prescribe medications at all. The problem with being a cardiologist is by the time they get to me, they've had a heart attack, they've had a stroke, they had open heart surgery, they have really crazy high cholesterol or blood pressure, and I need to put them on something. Now, we go out of our way to put people on generic medications that cost almost pennies a day, if not sometimes 65 cents for an entire month's worth supply. There are so many generic medications now in cardiology in almost every field that you don't actually really need to put people on the most expensive newer medications. Now, are there some medical conditions that need the most expensive medications? Sure, there are. Some of the new cancer stuff and whatnot is. Now, is there some medications that are superior that cost a little bit more? Yeah, like for example, in cardiology, we have aspirin and Plavix. We've had that for the longest time. Brilinta came along, or Crestor for that matter, whatever. Like a new medication comes along that gives you this much more benefit and this much more heart disease reduction for a little bit more. Like instead of paying, a $3 copay, it would be $30. If you can afford that, great. Otherwise, we could drop you back down to the generic that's always been there. Now, there are sometimes medications like, let's say you're on a new cholesterol medicine and it's working, but they're like, hey, for a 1.9% more reduction in absolute mortality, if you pay $20,000 a month, you can get this new medication that reduces it by another 1.8%. Like, no, that doesn't make any sense. I'm not going to try to prescribe a medication to a patient that's 20 grand a month or a year where they get this much more benefit. When you're getting this much more benefit, they probably had to really struggle to find benefit in those studies. So now, are there doctors that are paid by big pharma? Sure. They actually sit on the boards of big pharma. They're not your family doctor in Podunk, Iowa, trying to treat you for hypertension with some super generic hydrochlorothiazide, lisinopril, metoprolol, whatever. They're actually these doctors that sit on these huge boards that are making millions, 15, 20 million a year, supervising, coordinating, advising the boards of these big, huge pharmaceutical companies. Those are not the doctors or the nurse practitioners that you see every day to help you with your medical condition. So please, people, stop saying that we're all in bed with big pharma. Is big pharma necessary? Yeah, they provide us with a lot of medications that we would have otherwise never have discovered and never used, and some of them are life-saving. In fact, majority of them are probably life-saving if you need them. The vast majority of medications now are generic, so keep that in mind. So we are not going out of our way to prescribe only brand name, super expensive medications. We actually try not to do that unless you need it. And there are some conditions that obviously those medications will make a difference, but usually the guidelines change and say you should put them on it, and then the insurance companies have to drop the price anyways because now it's in the guidelines and everybody needs to be on it. So the point I'm trying to make is your doctor is not in bed with big pharma. If you are seeing them in the office, they are not in bed with big pharma. Those doctors are like on the boardrooms and making millions. Do we get free lunches sometimes from big pharma? Yeah, of course. They bring us lunch, they bring us samples. It helps us, our staff doesn't make as much as we do, and it feeds our staff for days sometimes. So yeah, we definitely do that, and I'm sure you could look that up. The numbers are publicly available. But that's not called being paid by big pharma. They bring us samples of some medication, you grab a lunch, it's like 10, 15 bucks, really not a big deal, but it definitely helps out with the staff and the morality, and everybody's excited because we're getting this cool, free fancy lunch, as opposed to having to leave campus and not be on campus and going and buying something cheap from some fast food place. So there is that, but that's not what I think people mean when they say you're in bed with big pharma. So just some thoughts today, because I feel like, there's a huge misconception out there that all doctors are out there making bank from big pharma, and that's why we push pills, and that's why we want to get everybody on medications. Not true, people. It's not. It really just isn't. So grab some of my free stuff below, and we'll talk next time.